Good morning, everyone. Thank you so much for joining us this morning on the Caregiver Teleconnection series. We have the impact of gender and sexuality on caregiving today. And I'm going to tell you about our presenters. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally and is focused on the complexity of issues related to aging and caregiving. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center at a respite program for family caregivers. There, she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. And in 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, awarded for her dedication in developing a national coalition to support caregivers. She's been a key architect of screening and assessment tools of family caregivers and has provided training to professionals across North America. Lucy consults for private industry, including WellMed Charitable Foundation and clinics in Texas. And on a personal note, Lucy would like me to tell you that she was a caregiver for her own mother for 10 years. So with that, Lucy, Elliot, take it away.
Thanks so much. Welcome. And to those of you participating today, welcome. Also, a special welcome as I see that we have someone very special in our audience, world famous Bob, who's been one of our guests in this series a couple of years running. So welcome, everyone. Thank you so much. And hopefully for other programs as well in our Pride of Caring series this year. As Evelyn mentioned, I believe this is our 6th year of hosting this program, which we've had some really, really interesting programs. And today, I think will be really one of them. It is for us, and I hope it will be interactive. We invite your participation and your input. And we're here to really discuss the role of sexuality and gender identity. And does it matter in the caregiving journey? How and why? We're also going to talk about gender identity. And as we do that, I wanted to make sure that everyone understands what the letters LGBTQIA+ stand for. And the full acronym includes lesbian, gay, bisexual, transgender, queer, and or questioning, intersex and asexual or ally. And there are actually other acronyms, longer ones. Two-spirit are sometimes included as well. And they are even more encompassing. So because our programs are only about 1 hour long, we often use a shorter acronym, LGBT or LGBTQ or LGBTQ+, but it is not to exclude or remove anyone from the discussion. There are no right or wrong words in our conversations, and we're here to learn and to share with one another. So each year we've hosted programs actually for Men's Health Month, actually in November. And here we are in June, and there is an intersection to these things, as you may or may not know, but June is Pride Month, November is Men's Health Month. And the role of gender and sexuality is one that I have been talking about for a very long time. Last fall, actually, at the annual meeting of the American Public Health Association, I gave a talk about men and caregiving. Despite the fact that there are 15 million male caregivers in the US, the majority of caregiver support programs really focus upon women. And there are some reasons for that. Women do live longer than men, but that's changing. And in addition, LGBTQ adults become caregivers at a higher rate than their non-LGBTQ caregiver peers. But very few programs focus on the needs of these community members who experience often more isolation and more discrimination when it comes to accessing healthcare and long-term care.
Thank you for that, Elliot. Thank you, everyone, for joining us today. You know, in our society, providing care is still often considered to be a feminine role. If you think of the word maternal, for example, it is associated with being caring. Many cultures still consider the provision of care and the role of caregiving to be associated with women. But in reality, that is not the case. And as people get older, the division of caregivers by gender narrows. Across the board, it's estimated about 60% of caregivers are female and about 40% are male. But as people approach age 75, there is more of an equal division among caregiver gender. So, you know, I'm going to ask you a question that we've asked before, and the answer often depends on the person's culture, background, age, and if they are a health professional or not. So, as we begin our discussion today, what would like to ask you is, we want to know, do you think that gender identity and sexual identity matters when it comes to caregiving?
So, folks, if you're on the phone and would like to talk to us, just press *6, and I can see it on my little website here. And otherwise, just unmute yourself and tell us what you think.
It's a question that needs a little bit of thought. Anyways, it's a good way to kind of start opening to think about it in that perspective. I see somebody answered.
Yes, B said, I do not. I have not run into any issues, so to it. Due to it, sorry.
I figured. In the past, we've had some caregivers who say that they feel very strongly that the gender of a caregiver very much matters, and also the gender of a care recipient. We've had examples in the past of things like bathing and toileting that can be sensitive. And so it becomes an interesting discussion when you think about potentially a client or care recipient who might be gay. Does it then matter if their caregiver is male or female, if it is a paid caregiver, for example? Many people have different thoughts and feelings about this.
But it's something to think about as we go along, and maybe down the road, we'll have a better, clearer understanding of what all this is about.
So as I was saying, some people do feel more comfortable having someone of the same gender or gender identity or sexual identity serve as a caregiver. Many older adults feel that it's better to have a caregiver of the same gender to help with those intimate activities that I was talking about. But that's not always the case, and that's not always the case with members of the LGBTQ community as well. So it's a really good idea to engage a care recipient, if possible, in these discussions so that they are with a caregiver that they feel the most potentially comfortable with. And that's just one conversation. Let's talk more about the ways in which sexuality and gender identity can impact upon the caregiving journey. So LGBTQ adults have a very rich history of caring for both biological and chosen family. Chosen family are often what we refer to as friends or community members that we consider to be family of relation, even though we may not be related. So according to some recent data from the Hartford Foundation, LGBTQ plus adults are 1 to 2 times more likely to be a primary caregiver, and 1.2 times more likely, and 3.5 times or 3.5 times more likely to provide care for friends and chosen family. As we said earlier, members of our community often become caregivers at a higher rate. But yet our caregivers also report higher rates of social isolation and depression, as well as high rates of discrimination in healthcare settings. These things are changing, and it is encouraging to see that. And I like to focus on the positives. We're going to talk about that. But these challenges, coupled with fear of additional discrimination, and that's a really big one, it can result in caregivers and care recipients delaying or forgoing much needed care. As our population ages overall, the LGBTQ LGBTQ plus older adult population will increase to an anticipated 5 million by 2030. It's right around the corner. And the number of LGBTQ plus caregivers will grow as well. It's already happening. Responding to unique needs is becoming increasingly critical. Now, caregiving can be a challenging experience on its own, and LGBTQ plus caregivers experience some additional complexity when navigating the health system, as well as human services systems. This is something that I recently encountered in trying to provide care to family members of mine who are not immediate family, they're cousins. And because of laws and HIPAA and so on, I'm bound in terms of what I can do, what I can ask for. When I see red flags, I'm only able to say so much to a social worker as an example. So there are a lot of different challenges that all caregivers experience, but I think there are some unique ones as well in the LGBTQ plus community. So beyond the legal and logistical challenges, which we'll talk a little bit more about in our program, I think personally, and I hate to speak for someone else, but since Lucy and I developed our program together, I'll speak for her too and say that I think the two of us agree that there are really two main issues, and we talked a lot about this, that we see as being very important in understanding why these challenges exist. The first one is that LGBTQ plus caregivers are traditionally overlooked. Now, we know caregivers are overlooked across the board. We don't teach, for example, in health profession programs very much to nurses and PAs and doctors about how to integrate and incorporate a caregiver into a care plan. That doesn't happen. We talk even less about minority populations of caregivers and what their challenges might be. In that instance, I think often LGBTQ plus caregivers are traditionally overlooked. And if you look at policies and programs that the care recipient has a single caregiver who is legally or biologically related. Now, that assumption excludes those who are cared for by a group of friends, like chosen family, partners, neighbors, sometimes just in more general care circles, which is very common in the LGBTQ plus community. Now, when policies and programs use terms such as family or spouse, some LGBTQ plus caregivers might feel excluded because they don't necessarily use the same language. And so to access services or to feel more comfortable, some LGBTQ plus caregivers resort to misrepresenting relationships. For example, saying a partner is a sibling. We've heard that from people's experiences before, or that they're a cousin or something else. And that's so sad. We want very much to hope that as we age, we can lead the most authentic lives possible and have that be welcomed. So the second reason too, obviously, is there is diversity and diversity of experiences within older LGBTQ plus community members, and recognizing that experiences of discrimination vary and intersect across sexual orientation and also gender identity. In addition to race, ethnicity, and other identities, these things are very important in understanding LGBTQ plus caregivers receive culturally appropriate care and, where necessary, trauma-informed care, meaning that the care that they receive understands an experience of trauma that they may have had. Transgender caregivers, for example, have different experiences and needs than their gay, lesbian, or bisexual counterparts, but we're all lumped into this one term. And transgender people often face even greater health disparities and challenges accessing care because of interpersonal transphobia, exclusion in the medical system, and also other forms of discrimination. Gay men, as another group, especially older gay men, experience often internalized homophobia and homonegativity, which is what happens when discrimination becomes internalized and can lead to feelings of shame, guilt, and low self-esteem. As a society, as Lucy was saying, many times we view the role of caregiving as a feminine role. And I believe that that's true in some cultures and perhaps some religions more than others. But if you think about how caregiver support programs are advertised, many target women as the primary audience. I've joked before, we've all heard of a place for mom, but is there a place for dad? And obviously he needs one too. So even within the LGBTQ plus community of caregivers, there are differences and there are unique experiences. Gay men may feel more isolated by virtue of caregiving and being a man, as I was saying, because so many caregiver programs are targeted at women, where lesbian women may feel that there are more overall caregiver supports because of their gender. However, because women still earn less money than men, they may have more financial constraints. And many men across the board and irrespective of sexual identity face challenges when it comes to caregiving because of the perceived feminine role of caregiving in our society. So it's important to appreciate the feelings and the experiences of individuals, and also to recognize that things are not consistent across the board, that the LGBTQ plus represent many different people within one umbrella. People living in rural areas, as another example, may have very different experiences of living as an LGBTQ plus adult or caregiver than perhaps LGBTQ adults living in big cities where they may have more services and more support. So there's a lot of variance. And older community members have different generational experiences than younger generations. Our perspectives are different. But I can tell you this, as a healthcare educator, our curricula for training medical students, nurses, physician associates, social workers, and I can go on, does not adequately address the inherent diversity and diversity of experiences of the LGBTQ plus community.
Thank you, Elliot, for that. I think there was something written in our chat. Would you like to have a look at it?
World famous Bob shared one thing I've done that I encourage the participants in our programs to also do is fill out hospitalization forms that allow non-biological people the same entry rights into the hospital that are given to biological family members. This form is free online and requires 2 witness signatures to be valid. I then email it to everyone on the form and my partner. My drag kids and my partner are my caregivers. That's awesome. And yes, it's something that we have recommended in previous programs that people do as part of what we call the folder, all the important paperwork that you should have. That's a very important one. And unfortunately, often people wait until a crisis happens, and then they don't have all these things in place. So planning is so important.
So thank you for that, Bob. That is something I just learned. Okay, so how does all this tie into caregiving issues? It is because our experience with healthcare are different based upon things like gender and sexuality identity. We know this to be well documented. In addition, when issues in our environment are present, as Elliot shared, it increases the stress that a caregiver experiences. As an example, 2023 marked the 50th year since the American Psychiatric Association Board of Trustees voted to declassify homosexuality as a mental disorder in their Manual of Mental Disorders. Could you imagine people who lived in those days were right, if you were gay, you had a mental health disorder. For LGBTQ caregivers who grew up during a time when their sexuality may have been considered a mental disorder, there may be an added barrier of distrust of mental health providers, and I can understand why, based on personal experience or historical knowledge, which may have implications for both a caregiver and the person they're caring for. You know, though healthcare has evolved considerably, the early life experience of today's seniors were undoubtedly shaped by the earlier attitudes and beliefs about sexuality. We have hosted this program, Evelyn was asking us, for about 6 years. And we host our program in June because it is Pride Month. which shows us the struggles for civil rights and the ongoing pursuit of equal justice under the law, as well as the accomplishments of lesbian, gay, bisexual, transgender, and queer LGBTQ plus individuals. As for all caregivers, we know that the role comes with many rewards as well, but many challenges. LGBTQ caregivers face several unique challenges that are related to their sexual orientation or gender identity, in addition to those Elliot spoke to about whatever was going on during different issues. LGBT caregivers may also experience emotional stress and isolation, especially if their loved ones are not accepting of their sexual identity or gender identity. They may also face legal barriers related to marriage, adoption, inheritance, which can complicate and their caregiving responsibilities. Another issue that LGBT caregivers face is the lack of representation and resources specifically tailored to their needs. Many caregivers may not have access to LGBT Q-friendly support groups or information on how to navigate legal and financial issues related to their caregiving responsibilities. Overall, it's important for healthcare providers and support organizations to be aware of the unique needs and challenges faced by LGBTQ caregivers and to provide them with the necessary resources and support they need to provide effective care for their loved ones. Now, LGBT rights have been an ongoing issue in the US, and there have been some instances where certain policies and laws have been passed or have sort of been diminished. For instance, in 2019, in the last administration, they proposed a rule that would allow healthcare providers to discriminate against LGBTQ individuals based on their religious belief. Furthermore, in recent years, several states have passed laws restricting or prohibiting transgender people from using restrooms that aligned with their gender identity. Recently, these discrimination policies have been increasing. However, it's important to note that there are also ongoing efforts to protect and promote LGBTQ rights at the state and federal levels. Despite this, the reality for many people including some very, very challenging situations. So let's just look quickly on them. I know sometimes we're repeating it, but it's so important to keep that in mind. There is discrimination. There's no doubt about it. There's a lack of family support. Many LGBTQ seniors are estranged from their families or do not have children living with them without support system in their later years. Now, there could be financial insecurities as well. Health disparities. LGBTQ seniors are at a higher risk of certain health concerns, including depression, HIV, and cardiovascular disease. Now, there could be, as we know, there's a lack of inclusive services. Many seniors, care facilities, and programs are not inclusive or accepting of LGBTQ individuals, making it difficult for them to access appropriate care. We've heard that a lot, especially when people need long-term care. Now, social isolation, in general, caregivers can isolate themselves, but LGBT seniors are more likely to live alone and lack support, social supports, which can lead to social isolation and loneliness and depression. Fear of discrimination and harassment. Many LGBTQ seniors are hesitant to reveal their sexual orientation or gender identity due to the fear of discrimination or harassment, which can further increase their isolation and lack of access to services. So having said all that, I would like to ask you all a question. I'm curious to know how healthcare workers who might be participating today, do you worry about discrimination among co-workers or other agencies that you work with to support clients? So I don't know if there are any healthcare workers with us today, but if there are, we'd love to hear from you.
Yes, you remember you really make our presentations more valuable for the podcast. So please help us out. Say something, anything that would lead us to better understanding of what you're feeling and what's happening to you. And I think everyone's on Zoom today. So if you're on Zoom, please just unmute yourself.
We did get a message in the chat from world famous Bob. Creating specific spaces for LGBTQ plus caregivers is key. We have a monthly online peer-led support group open to all who are LGBTQ plus and are in the role of caregiver. And the link is posted here for the meetup that world famous Bob's group does in Austin, Texas. So if you are in the Austin area, the link is in the chat. And Bob, if you want to share any information about your organization with us, you can feel free. And anyone nationwide is able to join as well. So thank you.
Anybody else?
Well, I just would like to share. I mean, I'm from Canada, living in Montreal, and though we're very aware of what's going on in the healthcare system, I do have to say that there's still that bit of sensitivity to include the LGBTQ plus population when developing services. So I'm now in the role of looking at developing certain services for younger individuals that have developed dementia. And I found that I really was the one that had to bring that up from, even though we were doctors and nurses and physios and OTs and social workers, that didn't come up until I kind of said, well, what about this population? Oh, yes, for sure, for sure. There was no doubt that we wanted to work on that, but it didn't come up automatically. So I'm just, I'm thinking that that's probably what's going on a little bit more also possibly in the healthcare system in the United States.
If I may, I think Elliot really hit the nail on the head when he talked about education. I think a lot of what healthcare providers go through in their training opens them up to sort of general health. But when they don't know the transgender community, when they don't know the gay and lesbian community, and they are faced with it, I think it's difficult for them. I think they become afraid of addressing things that they don't know about. So there's a lot of work that we need to do in this country, probably all over the world, to really incorporate that into educational resources.
Hi, Elliot and Lucy, it's Bob. I couldn't figure out the raise hand function. I'm so sorry.
No.
I just wanted, first of all, I want to thank you all so much for doing this work. It's so important. And the reason why I'm listening today is I always have something to learn from my colleagues in this field. And again, I learned something today. I want to just piggyback on that and say, it feels like because a lot of older people who don't need long-term care are feeling more comfortable coming out of the closet, so to speak, or transitioning to their true genders, that there's this big money grab happening. And what I mean by that is there are a lot of facilities that I think have good intentions, but don't realize you have to do more than put a rainbow flag in the door, right? So you have the rainbow flag in the door. What happens when somebody comes in and there's not a bathroom for them to use? There's not a gender neutral bathroom, or the forms are binary, Mr. and Miss or Mrs. So I think education, I just wanted to jump in. Education is such a huge part of cultural competency. And there are organizations that provide that. There are things online for free. There's Rainbow Connections ATX, the program I do here in Austin, Texas for family elder care. We did the SAGE care training. And so 130 employees went through everyone from the receptionist to the client facing workers to the board of directors, right? Went through this training, and I learned so much from that training. And I am a queer person, so there's always more to learn. And I just want to thank you all so much for doing this today. And yeah, if anyone's listening and they work at an agency, Lucy, you saying, well, what about the LGBTQ plus? Oh yeah, we want them too. It needs to be, diversity and inclusion has become such a checkbox, right? Do we have people of color in the room? Do we have a queer person? And people aren't grocery lists. And we're all, teetering that line too, right? We want to include people, but we don't want to tokenize people. As a programming director, a specialist, it's hard for me to toe that line as well. And because I'm white, so I'm constantly like, am I in the right space? Are my intentions correct? And I think educational programs like this, I see people are listening in. And if you work at an organization at all, and regardless of what type of organization it is, bringing those questions to the table like Lucy did. Well, what about this community? When they say yes, yes, it's just the beginning. Well, how can we get some training in here? Because and allies are so needed. If you're listening to this and you're not in the LGBTQ plus community, we need you more than ever, because you're going to have a seat at the tables where we may not. And that's going to give you the ears of people that maybe you can influence. So I just wanted to thank Lucy for bringing that up at her organization, and really just encourage people, being an ally isn't just being okay with it. It's supporting us. It's standing up for us in the world, and maybe just having those conversations, well, what do our intake forms look like? Are they inclusive? If somebody was trans, would they feel uncomfortable filling out our forms? And it's so much to know. Don't worry about doing it wrong. Just ask people for help. So thank you, Elliot and Lucy and Evelyn, so much for helping us today.
Well,
Well,
thank you so much.
Thank you for that.
You always have so much to share. And Bob, if you want to share information in the chat about your group in Texas, by all means, feel free. We did get some additional chats in the in our chat box. And actually, Bob, if you have anything to add to this, someone wrote, I find it very difficult to reach out to local LGBTQ plus organizations. I have reached out to SAGE and contacted their local chapters, but have not yet heard anything back. Do you have any suggestions? I do have clients that are asking for referrals to organizations where they can feel accepted and comfortable. It's surprising that there is no one that I can reach back out to at a AAA. And I have some feedback on that, but the reason why I asked Bob if you had any thoughts is because of your experience with SAGE. I will admit, actually, in the last week, I have reached out to a number of the LGBTQ plus hotlines that we include in our resources. I always do this every June because I don't want to circulate resources that are going to lead to dead ends for people that need them. And I was frustrated by a lack of callbacks, but I've recently learned that SAGE, for example, one of their programs, you leave information, you can do this online or by calling someone, and then they pair you up with a volunteer who will then call you back for one of their programs. But that process can take a couple of weeks, and that isn't something made expressly clear to many people. So I do understand the challenge. Secondarily, there are very, very few, like less than on one hand, I can count AAAs in the country that have dedicated staff to help with LGBTQ plus caregivers. So it's very important that we use the national resources wherever possible, because there is definitely a lack of local resources. I don't want to put you on the spot, Bob, but if you have anything to add, feel free.
Yeah, I used to work at SAGE. So SAGE used to have a hotline that I promoted a lot, and they have a new offering now, and I put the link in there, and they do connect you with somebody. It's a little bit different. And also the SAGE, if you reached out to a SAGE and it's not in New York City, the SAGE affiliate program has been pulled back. So what that means is there's only 5 SAGE centers in New York City where it originated, and 2 outside of New York State that are grandfathered in, so to speak. All of the other affiliates are rebranding themselves because the SAGE affiliate model has ended. So what that means is if you're in Baltimore and there's a Baltimore SAGE, it's not a SAGE anymore. They have created a new program, a new way to interact with centers nationwide called SAGE Collab. And all of those centers and all of those programs that used to be SAGEs are going to be SAGE collabs now. It kind of, the new model frees up organizations as a SAGE affiliate, almost like a franchise. There were so many structures in place that they feel didn't support people of color enough, trans people, and people in rural areas enough. So they did a lot of research before they did this because they knew it would cause a lot of waves. And Rainbow Connections ATX, that's where I work. We are a SAGE collab. Family Elder Care, we're a SAGE collab. And any organization, also, if your organization, if you're like, I'm having a hard time getting back to somebody, reach out to SAGE for your organization or talk to the person who can for your organization and look into the process of becoming a SAGE collab. Basically, what that means, you're not becoming a SAGE because you can't do that anymore. But what that means is you have all the support and you're in the network of SAGE, and they will assist you and support you in including this into your work. And I will say this too, Rainbow Connections ATX is 2.5 people. So it's me, Richard, and my boss is also head of the counseling department at Family Elder Care. So a lot of these resources, SAGE definitely is well funded and has a great staff. So I wouldn't give up. It might be who you're contacting. SAGE also has a resource map on their website. So SAGE National Resource Map, you can pull up the map of the United States of America and you can click on the state and it will list all of the organizations that have gone through their training, everything that's been vetted. So that's a really powerful resource. Maybe you can click on your state and see who else has been in contact with SAGE, reach out to them and say, hey, you know, we're interested. Did you get the training? Can you provide training for us? That type of thing. So
thank you so
it's
much.
also June.
That's so helpful.
It's also June, right? So these oftentimes understaffed, overworked, usually queer people who are in full-time plus jobs to serve their community are a little overextended. So I would say always, you know, this is a 12-month-a-year project, not a 1-month-a-year idea. So those are my suggestions I have.
Thank you so much. They're all excellent ones. My last suggestion too is if you don't reach anyone successfully at SAGE the first time and they don't call you back, be a squeaky wheel who gets the grease and call them back. Because I did find last week when I called, I didn't get a call back immediately. I called again and I spoke with someone else who was super helpful. So we will share all those resources at the end of our program. And I would also encourage you to come and join us next week because we will be doing a community spotlight on Jewish Community Services of South Florida and speaking with their director of programs for LGBTQ plus programs and services. They are a Lambda Living program affiliate, which is different than SAGE, and we're going to talk a bit about that. We did get another question in the chat from B. I care for my mom and dad, and what I am worried about is my wife partner having access to her in-laws when we are in a healthcare facility like urgent care or hospital. In addition, she is a different race that also comes into play at times. She gets crazy looks when she says she is a daughter. So that's a great question. And I would again suggest taking care of that paperwork that Bob was talking about for visitation access. We'll also share those resources at the end of our program. And we have a recorded program that refers to all of the specific paperwork that you may want to have in place, including a living will. We did get another chat. I have reached out to the local chapter for training, but we'll continue to contact and cross my fingers that we hear back. Thank you. This is very helpful. And thank you, Bob, so much for all of the links that you've shared. I am sensitive to time, but I love a conversation more than anything and sharing of amazing resources. So thank you again, Bob, so very much. I do want to talk a little bit about progress in long-term care that is being made. And it's something that we're going to circle back on in our last program of the month, focused upon the connection between the LGBTQ plus community and Alzheimer's and related dementia. You may not know it, but our community has a higher potential incidence of Alzheimer's and related dementia. And long-term care becomes an issue, certainly for fear of discrimination, but also of training staff to be culturally competent. One of the newest studies to have come out found that caregivers were really surprised to learn that they saw a lack of discrimination. I'm speaking specifically about LGBTQ couples where one entered long-term care. However, that even the fact that they received no discrimination did not diminish their feelings of discomfort because of their own perceived concerns that they would experience discrimination. So we as community members have some work to do too. We talk a lot about needing to educate other populations and do training, but this is important. So very quickly in sum, I do want to mention that in 2023, 200 long-term care communities across 34 states participated in the Long-Term Care Equality Index and Human Rights Campaign. And these facilities had training on being inclusive to the LGBTQ plus community, much in the way that Bob was describing through SAGE, although this relates to long-term. 90% of these facilities updated their resident and employee non-discrimination policies, compared to only 18% of communities in the 2021 LEI. So there is progress being made, but as a whole, only 5% of long-term care facilities have abuse and neglect policies that explicitly protect LGBTQ plus residents. That's an issue, and it's one that we need to work on. So I also want to be sure that we get to talk a little bit about marriage and caregiving before we end today, because it's an important one. For gay couples in the United States, the option to marry only became legal in 2015, not even 10 years ago. Now, marriage has significant implications for caregivers in terms of things like hospital visitation that we were talking about, but also benefits like Family Medical Leave Act, or FMLA, to take time off from work to care for a loved one, spousal benefits through Social Security, for example. So what we're seeing right now is that many couples who had been together for decades, unmarried, never even considered how marriage could affect them and their potential need for caregiving as we age. So there is a very big issue that we need to make people aware of in terms of FMLA and survivorship and benefits, because many older gay couples are not married potentially and feel that that there isn't a need to do so. But as we age, there becomes some different considerations in place. So again, I really want to say this topic, I think, is so important for younger generations too, because it's important that we plan, that we start recognizing that as we age, we're going to need help, most likely, especially if we don't have immediate family. And many people simply don't realize that LGBTQ plus adults become caregivers more often than their heterosexual counterparts, including us LGBTQ plus adults. So, if we knew about this now, might we plan differently? And also, if we thought about who we would look after our parents, for example, among our siblings or our friends or close to us, we would also perhaps recognize that we own more of that responsibility sometimes. But it's a very hard thing to face and to recognize. LGBTQ plus adults are less likely to have children. We are more likely to assume caregiving responsibilities for aging parents than for other chosen family, yet we don't talk about it, and we're not encouraged as a community to do that. If you think about it, how many movies have you seen about married gay couples? How many TV shows have you seen about older LGBTQ couples who are in caregiving situations? I can't think of any. And those depictions become important. I know we don't have them in the heterosexual community at large either. But to my point, I grew up at a time of the movie The Birdcage, and Nathan Lane in the movie The Birdcage was only 39 years old. So I am now older than Nathan Lane was in The Birdcage, and I think of these issues. I very much enjoyed the fact that the Netflix show Grace and Frankie introduced the issue of coming out later in life among couples who were married and who had lived their lives as heterosexuals. But the show kind of went off the rails a little bit and became a little less serious. But I think it's really important that we think about the depictions out there. Again, back to that issue of life experience. So in the 80s, the US life expectancy for a gay man was less than 50 years of age because of the impact of the AIDS crisis. There wasn't as much of a focus on gay men aging and needing care, as an example. A lot of that has changed. And we lack representation of how these things have changed, especially among minority groups of caregivers. Here again, if you do a quick Google image search and you do this from your own computer, I always love showing this. If you look up family caregiver, you don't see a lot of LGBTQ plus representation. You also don't see a lot of men as a whole. So, I use these as teachable moments because we can do these on our own. We can look up these images on our own. And I feel that it's so important that we just, as Bob was saying, help educate others too. Usually I feel when I talk about this issue at senior groups across South Florida, like I was the only member of the LGBTQ community in a room talking about caregiving. But I know that isn't the case. And so it's important that we talk about these things, we sensitize others. So what do the caregivers out there feel? Do we feel represented, isolated? Do we think caregiving is gendered in our society? These are things I'm going to leave you to ponder on your own, and I will ask Lucy to wrap up.
Yes, you were saying, Bob, that you learned a lot. Well, I certainly learned a lot from doing and developing this session. That's the wonderful thing as we update and we educate ourselves. So we identified a lot of challenges, and over the course of our series, this month we're doing to discuss some of them in more depth. We felt it was important to have a program to discuss the experience of LGBTQ plus seniors and caregivers. Just bringing these issues to awareness can feel comforting or reassuring for an LGBTQ community member. It's also important as a means of sensitizing one another to the challenges that exist. So despite these challenges, LGBTQ plus caregivers are strong and resilient like all caregivers. They're often able to overcome these obstacles and provide loving and compassionate care for their loved ones. So let's look about a few tips that I would like to share with you. It's so important that if you need support, find a support group. There are many support groups available for LGBTQ caregivers. These groups can provide a safe place to share experience, connect with others, and get support. Reach out to your community. There are many organizations that offer services and support to LGBTQ plus caregivers. These organizations can help you find financial assistance, legal help, and other resources. They might be limited, but there are. Take care of yourself. That's really, really important. We tell caregivers all the time. Caregiving can be stressful, so it's important to take care of yourself every single day. Make sure to get enough sleep, eat healthy foods, exercise regularly. You should also find time to relax and do things you enjoy. If you are a healthcare worker, think about some of the sensitivities we discussed today. Do you think that your organization reflects LGBTQ couples in marketing and even intake forms, as Bob said? And I have to say that now that I'm working in this new organization, I changed the form. So I'm really pleased about that because it was Mr. Mrs. So if you are an LGBTQ caregiver, you are not alone. There are many resources available to help you. Please reach out to help if you need it. Remember, there are two people in this caregiving journey. Each one is as important as the other one. And I always talk about this, Elliot and I both say, it's a balancing act. You're just as important as the person you're caring for. And thank you for all the things that you do.
Absolutely. And likewise, some of these resources may be of benefit to the person for whom you're providing care, just as they would be for yourself. So we do have a lot of resources here to share. If you see something will get a copy if you registered for our program today of our presentation slides. Anything that is highlighted in blue is a hyperlink. So if you just click on that, it will take you directly to the website as an example. We also do have the WellMed Caregiver Teleconnection YouTube channel linked here. So the previous programs that Evelyn had mentioned that we talked about, including those about specific resources and paperwork that you might want to have in place, you can find those online too. In the chat box, all of the wonderful resources that Bob shared today. And Bob, thank you so much for your help, your participation, your advocacy, everything that you do. And for those in the Austin area, please link up with Bob and her organization that she shared information in our chat box.
And that's nationwide, right?
It is, and anyone can access it. So it's a great thing that they have going. So the meetup link that Bob posted, you can access nationwide.
Very cool. Well, I want to thank Lucy and Elliot so much for, boy, did I learn a lot today. This is not my area of expertise, but we all need to make it our area of expertise, you know, when we're working with people. So I really appreciate the information. I thank you so much. And those of you who participated, thank you, thank you. Thank you, Bob. All of you who are caregivers, who are trying your hardest and your best, and hopefully are taking care of yourself at the same time while you're being a caregiver. Thank you so much. I have a few other things I want us to say to folks. We've got a lot of really good presentations coming up this month. We have on Monday, June 10th, the Magnificent Seven Legal Documents for Older Adults, who's with an attorney. On next Wednesday, we have Caring for Your Brain with Dr. Juan Simon, which will be in Spanish. On Thursday, June 13th, the Pride of Caring, Agency Spotlight, Jewish Community Services. And then Wednesday, the 19th, Lola, Loss of Life Advocates with Esther Peopley. That's a really nice one. She's very practical. On Monday, June 24th, Financial Planning for Older Adults, What Family Caregivers Need to Know with John Leithner. And then the last one is on Thursday, June 27th, The Pride of Caring, Alzheimer's, Dementia, and the LGBTQ plus community with our beloved dear Lucy and Dr. Sklar. So thank you so much for participating today. We're so happy you're here. I think we have a lot of congratulatory chats for our speakers that are left here. But otherwise, what I'm going to do, we have time for another question if you guys want to open it up.
Certainly, if anyone has any last questions or comments, welcome.
Let's see.
Also, a lot of great information in our chat, and I reposted the meetup link for the Austin area meetup. But again, that is online virtually and can be accessed by anyone across the country.
So you did repost it?
Yes, I did.
Okay.
Which form link were you looking for? Can you tell us, and I will repost that.
Oh, for her part.
The link to the online document. So if you look at the Caregiver Teleconnection YouTube channel, you'll be able to search Pride of Caring. And in previous years, Lucy and I have done a program called The Folder, which includes all of the relevant paperwork that you might want to have in place, including a living will, visitation forms, additional information about Medicaid eligibility, for example, lots of good stuff there. There may be additional programs that you might find on the YouTube channel that might be of assistance as well.
Great. Let's see. We have one new message. Let me see that one.
It was just a thank you.
Okay, great. Well, thank you all so very much. This was a fabulous presentation. And I think we all learned a lot. And as Lucy said, even, when you do research to present these things, you learn so much. So thank you for your research and the hard work that you put into that. And obviously it shows. So we'll see you next week on Thursday. And very happy to see you again. I haven't worked with you for a little while, so I appreciate that too. So with that,
likewise.
Thank
you so much. And B, one last thing, some of the resources that you see on the screen here will also have some of that paperwork that you're looking for. So you can reach out to the LGBTQ Caregiver Center. They have a number of the different paperwork options that you need. Also, the GLBT National Health Center has a huge database too.
Thank you, Elliot. Thank you so much, Lucy. Thank you, everyone. And thanks to WellMed for helping put all this stuff together and supporting it. And we're very, very pleased to be part of this enterprise. And with that, I am going to close the recording. Let's see, it's here somewhere. There we go. Thank you all so very much.
Bye, everybody. And